Hello, everyone. Welcome back to the channel. Today, we're talking about a topic that affects millions of families, colon cancer in older adults, and how it differs compared to younger patients. You may have seen the headlines in recent years. Colon cancer cases are rising in people under 50. That's true, and it's important. But here's something many people don't realize. The majority of colon cancer cases still happen in adults over the age of 60. And that matters because the disease doesn't always look the same in older patients. The risks are different. The symptoms can be overlooked, and even the treatments must be carefully tailored. So in this video, we'll break down exactly what makes colon cancer in older adults unique, so you can understand the challenges, the opportunities, and most importantly, what can be done for prevention, early diagnosis, and better outcomes. Let's get started. 1. Overview of colon cancer. So what exactly is colon cancer? The colon, or large intestine, is the final part of our digestive system. Colon cancer begins when cells in the lining grow out of control, often starting as polyps. Most polyps are harmless, but some can slowly turn into cancer if not removed. Why does this happen? It's usually a mix of genetics, lifestyle, and age. Risk factors include a low-fiber diet, inactivity, smoking, heavy alcohol use, and family history. But age is the strongest factor. The longer we live, the more DNA damage and lifestyle effects build up. So colon cancer is most often diagnosed after 60, even though younger cases are rising. In short, colon cancer in older adults is shaped by both time and experience, decades of exposure, and the natural changes of aging. 2. Older versus younger. Now that we understand what colon cancer is, let's take a closer look at who it affects and how that's been changing over time. Here's the reality. Colon cancer is still overwhelmingly a disease of older adults. In the United States, the average age at diagnosis is around 68 for men and 72 for women. More than half of all new cases occur in people over the age of 65. But at the same time, something unusual is happening. Over the past 2 decades, we've seen a steady rise in colon and rectal cancers among younger adults, those under 50. In fact, early onset cases now make up about 1 in 5 new diagnoses. So what does this mean? It means we're seeing 2 very different stories unfold at the same time. For older adults, the disease is still far more common. They carry the largest burden of cases and, unfortunately, the highest rates of death. Age, accumulated risk factors, and often delayed recognition of symptoms all play a role. For younger adults, the absolute numbers are smaller, but the trend is going in the wrong direction. Their cases are increasing, often presenting at more advanced stages, and sometimes with more aggressive tumor biology. The contrast is striking. Older adults equals higher overall numbers, shaped by age and long-term exposures. Younger adults equals faster growth in incidence, raising new questions about lifestyle, environment, and genetics. So when we focus on colon cancer in older adults, we're not ignoring the younger story. Instead, we're acknowledging that while the spotlight is often on rising young cases, the majority of people facing this disease are still over 60, and understanding their unique challenges is just as critical. 3. Key differences in older adulthood. Now let's dive into the most important part of today's discussion. What makes colon cancer in older adults different from cases in younger patients? There are several key differences, ranging from risk factors to symptoms to tumor biology, diagnosis, and even treatment. Let's go through them one by one. A. Risk factors. First, the risk factors. For older adults, colon cancer risk is often the result of cumulative exposure. Think about it this way. Decades of dietary habits, alcohol use, smoking, or sedentary lifestyle all add up. Add to that the natural aging of the immune system, which becomes less efficient at repairing DNA damage, and the risk increases further. Older adults also have higher rates of other medical conditions like diabetes, obesity, or cardiovascular disease, which can indirectly contribute to cancer risk. By contrast, in younger patients, colon cancer is more often tied to genetic factors or unusual molecular changes. In other words, for older adults, it's usually about time and accumulated exposure, while for younger adults, it's sometimes about inherited risk or aggressive biology. B. Symptoms and presentation. Second, let's talk about symptoms. In older adults, symptoms of colon cancer often overlap with normal aging or other chronic conditions. Things like changes in bowel habits, anemia, fatigue, or unexplained weight loss might be brushed off as just getting older. Unfortunately, this means colon cancer can sometimes go unrecognized until it's more advanced. In younger adults, by comparison, symptoms tend to be more obvious and sometimes more aggressive, like rectal bleeding or severe abdominal pain, which often prompt earlier medical evaluation. So, one of the challenges in older adults is that symptoms can be subtle, easily dismissed, or attributed to something else. C. Tumor biology. Third, the biology of the tumors. Older adults are more likely to develop the traditional form of colon adenocarcinoma, the classic type that develops from long-standing polyps. Younger patients, however, are more likely to have cancers with genetic differences, such as microsatellite instability or syndromes like Lynch syndrome. These cancers may behave differently and sometimes more aggressively. So while both groups face colon cancer, the underlying biology often isn't the same. D. Diagnosis and screening. Fourth, diagnosis and screening. Older adults are more likely to be diagnosed during routine screening, like a colonoscopy. In fact, colonoscopy remains the gold standard, and it's one reason why we recommend regular screening starting at age 45, or sometimes earlier if there's a family history. But here's an important point. Many older adults get diagnosed because they are still being screened. Younger adults, on the other hand, often aren't being screened at all. That's why their cancers are more likely to be caught at later stages, after symptoms appear. This highlights why screening guidelines are so crucial and why decisions about screening past age 75 should always be personalized, not automatic. Treatment considerations. Finally, let's talk about treatment. For older adults, treatment is often more complex. Surgery, chemotherapy, and radiation are all effective, but the reality is that not every patient can tolerate them in the same way. Older adults may have other medical conditions, reduced organ function, or frailty that limit how aggressive we can be. Polypharmacy, taking multiple medications, can also create complications. That means treatment has to be carefully balanced. We don't just look at the cancer, we look at the whole person, their health, their independence, their goals, and their quality of life. By contrast, younger patients tend to tolerate intensive treatment better. Doctors are more likely to push aggressive therapy with the goal of long-term survival. For older adults, the art of treatment is about individualization, choosing options that not only extend life, but also preserve dignity, comfort, and function. Transition to next section. So when we step back, the differences become clear. Older adults face colon cancer shaped by long-term exposures, subtler symptoms, more traditional tumor biology, and unique challenges in both diagnosis and treatment. And that brings us to the next critical question. How do we manage these challenges in real life while still offering older patients the best possible outcomes? 4. Challenges in managing older adults. Now that we've seen how colon cancer in older adults differs from younger patients, let's talk about the unique challenges in managing it. Because the truth is, treatment isn't just about the cancer itself, it's also about the person who carries it. Frailty and functional status. One of the biggest challenges is frailty. Not all 60, 70, or 80-year-olds are the same. Some remain active, independent, and strong. Others may struggle with daily tasks, fatigue, or limited mobility. Frailty affects how well someone can handle surgery, chemotherapy, or radiation. A treatment that's life-saving for one patient may be overwhelming for another. This is why doctors now use special assessments called geriatric evaluations to guide decisions based not just on age, but on overall health and resilience. Multiple medical conditions. Another challenge is comorbidity, or having multiple medical conditions at the same time. Many older adults are already living with heart disease, diabetes, kidney problems, or lung conditions. These can complicate treatment decisions. Chemotherapy might stress the heart, or surgery might carry higher risks if lung function is poor. Balancing all of these factors is like walking a tightrope. We have to treat the cancer without making other health issues worse. Medications and interactions. Then there's the issue of polypharmacy, taking multiple medications. It's very common for older adults to be on 5, 10, or even more daily prescriptions. Some cancer treatments can interfere with these medicines or increase side effects. So part of managing colon cancer in older adults is carefully reviewing every pill, every supplement, and making sure the treatment plan is safe. Cognition and emotional well-being. We also have to consider cognition and emotional well being. Memory changes, dementia, or even mild cognitive decline can affect how well a patient understands their diagnosis, remembers to take medications, or follows through with appointments. On top of that, the emotional weight of cancer, fear, anxiety, depression, can feel heavier with age, especially if someone has already lost friends or a spouse. Support systems, counseling, and clear communication become just as important as the medical treatment itself. Quality of life and ethics. And finally, there's the question of quality of life. For many older adults, the goal isn't just to live longer, it's to live better. That means doctors and families often face tough choices. Should we pursue aggressive treatment or focus on comfort, independence, and time with loved ones? These aren't easy conversations, but they are essential because every patient deserves care that reflects their values, their goals, and their definition of living well. Transition to next section. So managing colon cancer in older adults isn't just about medicine. It's about individualized care. And while these challenges are real, the good news is that there are powerful steps older adults can still take to lower their risk and protect their health, which brings us to prevention and lifestyle. 5. Prevention and lifestyle for older adults. We've talked about the risks and challenges of colon cancer in older adults, but here's the good news. There are still powerful steps you can take to protect your health even later in life. Prevention isn't just for the young, it matters at every age. Healthy diet and fiber. First, diet. A diet rich in fiber from fruits, vegetables, beans, and whole grains can help keep the colon healthy. Fiber speeds up the movement of waste, reduces inflammation, and lowers the chance of polyps turning into cancer. On the other hand, diets heavy in processed meats, red meat, and sugary or fried foods increase risk. Making small, consistent changes, even adding just a serving or two of vegetables a day, can make a meaningful difference over time. Physical activity. Second, staying active. Movement doesn't have to mean running marathons. Even 30 minutes of walking most days can improve digestion, lower inflammation, and reduce cancer risk. Physical activity also helps maintain strength, balance, and energy, key factors for healthy aging. Avoiding tobacco and limiting alcohol. Third, avoid tobacco and limit alcohol. Smoking isn't just a lung issue, it also increases colon cancer risk, and heavy alcohol use adds to the danger. Quitting smoking and cutting back on drinking are two of the most effective prevention steps at any age. Screening and early detection. And finally, screening. Colonoscopy and stool-based tests remain the most powerful tools we have to detect colon cancer early, or prevent it altogether by removing precancerous polyps. For adults between 45 and 75, regular screening is strongly recommended. But what about older adults beyond 75? The answer is, it depends. Decisions should be personalized, based on overall health, life expectancy, and patient preference. Some people in their 80s may still benefit, while others may not need it. The key is to have an open, honest conversation with your doctor about the right plan for you. Transition to closing. So while we can't change the fact that aging brings higher risks, we can change how we respond. Through lifestyle, through smart choices, and through proactive healthcare, older adults can still take strong steps toward prevention and better outcomes. And that brings us to one last important message to wrap up today's talk. 6. Closing. So to bring it all together, colon cancer in older adults is common, and it looks different than in younger patients. The risks build up over time. The symptoms can be subtle, and treatment requires careful balance with overall health. But here's the hopeful part. Prevention, early detection, and individualized care do make a difference. If you're over 60 or caring for someone who is, talk to your doctor about the right screening plan. Focus on diet, movement, and healthy habits. And remember, it's never too late to take steps that protect your health and quality of life. Thank you for joining me today. If you found this helpful, please share it with others and subscribe for more conversations about health and aging. Take care, and I'll see you in the next video.